Today, we are going to be discussing one of the most frequent questions that I have in my clinical practice. The question is, Dr. Medeiros, I have a friend or I have a family member who I believe is dealing with a mental health problem, but I'm not able to help him. How do you think that I should behave? So, there are 3 points that I like to highlight. The first point is do not avoid the subject. Try to talk about it in a relatively straightforward way. Something like, Mom, I love you. You were very important to me. And I'm a little concerned that you are a little bit more sad than usual. I don't see you leaving home. Um, is something happen? Would you like to discuss that? So the first point I would say, talk about it, show concern, and show that the person is not alone. The second point I would say, try to come with a treatment plan. When I say a treatment plan is with possible psychiatrists or possible psychologists or possible help that the person could have in case she acknowledges um, that she is dealing with something. She's dealing with a mental health problem. And ideally, the treatment plan, you already think about the potential barriers that the person will bring, right? Let's say that someone that's old and they don't want to leave the neighborhood. You maybe find someone who a psychologist who has an office very close, or a psychiatrist who sees the persons online. So I would say that the second is try to think about a plan, try to connect the patient with a provider, and already overcoming possible barriers. And the third one that's very important is we need to shift the way that we think. We need to try to think with the other person's mind. What's important for me may not be important for the person who is dealing with the problem. I always give this example. I had a patient, he was 70, and he smoked pretty much his whole life. And he knew that smoking was bad for the lungs, smoke was bad, uh, increased the risk for cancer, but he did not stop smoking. But when his grandson was born, it's just like his mind shifted. She wanted to be a great example to the grandson. He wanted to not have the bad smell that the grandson could not like it. So if you notice that there is something that's important, that the person is depressed and they are trying to go back to work, or if there is a specific point that's crucial for them, that's very important, try to use that to motivate them. So, in summary, I would say that you could try to help the person 3 ways. First one, talking about the problem, asking questions about the problem, and showing them that they are not alone. Second one, I would say come with a treatment plan that already overcomes some of the barriers that the person might come with. And third point, try to think with the other person's mind and try to motivate them with the points that are important for them, not for you. Thank you so much.